What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. Turf wars. Talking about turf wars today. This is a part of my nurse bullying series. I think we're on number 3 or number 4. Sorry, having a hard time keeping count. Talking about turf wars between units and between specialties. One too many times, far too many times, one area of nursing is pissed off at another area of nursing for something that they probably didn't do in the first place. We passively blame other units for either dumping on us, judging us, or for not working as hard as us. Example, there are many med-surg floors or non-specialty units, and I give med-surg as a general rule, med-surg nurses who will say that ICU nurses don't work as hard as med-surg because they don't have the same nurse-to-patient ratio. Med-surg can take up to, I think I've heard 13 to 1 sometimes, and of course ICUs 1 to 1, 2 to 1, in worst case scenarios 3 to 1. Then the ICU nurses will blame the med-surg nurses for not knowing how to work as hard as they do, or ICU nurses will claim that the monitored floor nurses have no idea what they're doing. And then there's always the ER ICU war that continues to go on, even though they sort of practice within the same lines of care. It's exhausting, it's stupid, and it's pointless. It solves no problems. All it does is just piss people off. Usually pisses off the person complaining, then it pisses off the person that they're complaining about. I really don't believe in my heart of hearts that there are nurses out there that are intentionally trying to dump on you or trying to slight you in some way. This passive-aggressive, talking under our breath, gossiping about other units is not solving problems. All it is adding fuel to the fire to make things worse. You have to remember that every unit has their own skill mix. Every unit has their own set of standards and procedures in regards to their patient population. Every unit has a different schedule. Don't judge another nurse, another nursing unit by a singular incident or even by a series of incidents, because just maybe, I don't know, maybe they're having a tough time. Maybe they're short-staffed. Maybe there's a new manager. Maybe there's a whole new set of new nurses that are still learning. Maybe they just lost a whole set of seasoned nurses that used to be the driving force behind their leadership. I don't know. Maybe there's a whole new set of standards that they have to follow. Maybe they, just like you, have people to answer to. This is not going to get better by finger pointing and undermining. We have to figure out a way to work together. If you feel slighted, if you feel like the handoff nurse from a transfer, an admission, or a discharge, if you feel that you were not treated appropriately, if you feel that there was something that should or should not have been done, I think you should voice your opinions to that specific nurse and to that specific nurse's supervisor. Don't go undermining and doing the whole passive-aggressive gossiping. Go to the source, get it taken care of, and move on. Communication is key. Open door communication is key. Let's figure out a way to stop the turf war. I know you have something to say about the turf war because if you've been doing this job for more than 2 months, you know it exists. You know how bad it is. So what words of wisdom do you have? What experiences do you have that you could share with the rest of the tribe that has made a difference in putting out this fire? Always want to hear from you. Leave your comments down below. You know your comments are my caffeine. Share this with somebody. And as always, check your own pulse first.